What's coming at this workforce? Why would they be boarding the buses in these numbers? Because this government is talking about making $15 billion in cuts to a deficit, and they're talking about cutting corporate taxes by $7.5 billion, which translates for us, just in our sector, to 3,400 hospital beds that would have to be closed, and 16,000 hospital staff would have to be cut to make up those numbers, let alone what would be going on in other sectors. And this is happening at a time that the Ontario population will grow by 30% over the next 20 years, and it's going to age, and the number of seniors will double, the number of over 70s will triple, the number of over 90s will quadruple, and people know what's going to be happening in terms of the tidal wave of demand for services that their threadbare staff is supposed to meet. And they want to fight it, and they want to resist, but they need to be given hope for that. They need to be laid in front of them a strategy, which is a hopeful strategy. And that has to be about unity, and it has to be about mobilization. And it can't just be about stopping cuts. It's got to be about, we need to add capacity. We need to add capacity to meet those challenges in long-term care. We need to deal with the exploitation of the workers in the home care system. These women who are making $16 an hour with no guaranteed hours of work and no mileage, driving for unpaid for hours in the country in unsafe situations to take care of people alone in their homes, right? Why do we put up with that? We need to give these people hope. We need to put in front of them a militant strategy, and that's why, of course, healthcare workers should really consider what our tactics would be with respect to a general strike. But certainly, I'm proud to say the entire CUPE Ontario Executive Board signed onto a letter that is in circulation, calling on political strikes if necessary to meet the challenges of what this government has planned for us. Because if the kind of motion that was passed at the Tory convention this weekend, which endorses and embraces the privatization of the delivery of healthcare, is what this government has in mind, then what would the workforce do to defend the public healthcare system? That's something that we have to put our minds to. So for us, we put extra effort. Louis over here is our prime organizer. He just spends a lot of his time visiting local to local, cajoling and encouraging and working with locals to get them to fill buses, and then to get them to do better the next time, and to get them to do better the time after that. And he was telling a story this morning about a local in Pembroke that started with 3 people, and it seemed like that wasn't much yield for a day spent going up to Pembroke, but now there were 20 of them on the bus. They only have 200 people in their workplace. Espanola, how many did we have? 30 on a bus out of 120 people came down to Toronto for that rally. But we can do better than that. What are we doing it for, though? We need to talk about adding capacity and building this socialized system of healthcare. That's what it's got to be about, because that's what gives people hope that on their work unit that they will be able to cope with this crushing workload that is beating them down and making their lives a misery. These men go home, they're broken physically, and they're crying in their cars when as they're leaving because of the guilt and because of the exhaustion of working in this system, which has been cheated and starved of funding. And it isn't just the Tories, it's been the Liberals, it's been the NDP. This is a 30-year progression of cuts in real terms that have been raining down on the healthcare system. So when we mobilize people, we've got to talk to them about a future where that doesn't happen, where patients are not turned away, where they're not living on stretchers, where they're not dying in hallways without dignity, without any privacy with their families. We've got to talk about a system in which the worker is respected, where they're not subject to violence, where they have basic human rights. We've got to talk about that stuff. We've got to talk about a vision of the future where we stand in front of them and we say we're leading them somewhere, and that somewhere is not just for us, but it's somewhere for everybody. That's what we got to do.